Community Regional Medical Center sees more than 3,000 patients experiencing trauma every year, and just over 1% of those patients have an advance directive on file. That's why teams across community are coming together to educate the public about creating these documents before an emergency strikes.
One thing I've discovered throughout my life is that you can't predict what's going to happen.
And for patients that end up in critical care, sometimes difficult decisions need to be made.
When cousins, aunts, uncles, parents are here and they're in our ICU and they're very sick and they can't speak for themselves, it falls on the families to make those decisions, and those are very hard.
Doctors say it's best to have some of those decisions made well in advance through an advance directive or POLST, physician's orders for life-sustaining treatment.
So it asks questions like, would you want to be intubated, meaning do you want a breathing tube placed in and put on a machine if you're not able to breathe for yourself? If your heart were to stop, do you want chest compressions, what we call CPR?
These legal documents also allow care teams to respect a patient's wishes when they may not be able to speak for themselves. UCSF Fresno's Chief of Palliative Care, Dr. Macmillan, says as difficult as the conversation about advanced care planning may be, it is still one that parents should have with their children.
When things do happen, and a family member gets a phone call in the middle of the night, for instance, or even in the middle of the day, and says, hey, your loved one is requiring aggressive life-sustaining treatment, that puts that loved one on the spot.
Assistant Trauma Medical Director David Jeffcoach says oftentimes patients that experience a major trauma are young.
18-year-olds aren't thinking about the end of life. I'm not surprised when an 18-year-old doesn't have an advance directive.
There are different recommendations for different ages, but the important part is having the conversation with your loved ones.
So I think having these decisions and these discussions about death, things that we don't like to talk about, traumas, things that we don't necessarily like to think about happening to us, having those conversations before the event happens makes it so much easier on the person on the other end of the phone.
For more information about advance directives or POLSTs, visit communitymedical.org/advanced care planning.